Hello there. Welcome back to BioNexus Health podcast series. Today, I'd like to focus on PANDAS flare-up. That's been a popular question that many viewers and patients have asked me. So as part of the continuing Q&A that I have undertaken, I thought today I would take some time to answer what do we do when you suspect or you see a PANDAS flare? Now, this could be a child on the autism spectrum. Over 90 to 95% is what I'm trying to say, of my patients with autism spectrum disorder have underlying PANDAS type issues. So what do we do when we see what looks like a PANDAS flare-up? Now, a flare-up obviously is sort of a relapse. Some parents call it regression. That happens when a child experiences the symptoms in an exacerbated manner, right? There could be behavioral symptoms like aggression, self-injurious behaviors, injuring others. There could be severe stimming, different kinds of sensory challenges that happen. Additionally, could be vocal stimming, could be hyperactivity, lack of focus, lack of concentration, unable to settle down, not feeling hungry, as in poor appetite. So these are various symptoms that are seen during a flare-up. Sometimes children complain of headaches. Children can also complain of aches and pains in their joints, the back. Children can sometimes start limping as well due to excruciating pain in their joints. All of these symptoms can be quite frightening for a parent to see.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a Ph.D. in Integrative Medicine, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
Now, I'm going to speak about certain scenarios that are very commonly seen and that I usually get requests from parents for an urgent appointment. For example, when there is a flare-up seen, right? This flare-up can be many symptoms coming back, or this flare-up can be just a few symptoms coming back. Often flare-ups are confused with Herxheimer reactions. So how does one differentiate between Herxheimer reactions, a small flare-up, and a large flare-up, right? Because when you have a few symptoms, that's a smaller flare-up. When you have a lot of symptoms coming back, that's obviously a larger flare-up. And then there's also the Herxheimer reactions or die-off reactions. So die-off reactions will typically happen within hours after taking an antimicrobial herb. Patients are usually counseled by me during their Zoom meetings as to when to expect a die-off reaction and how to handle a die-off reaction, right? So you will see an increase in symptoms within a few hours after starting a new herbal, a new antimicrobial herbal. Antimicrobial herbals are the herbals that kill off infections that we have found after we ran the labs for the patient, or sometimes, there is plenty of clinical evidence that there are underlying infections like tick-borne infections, Lyme disease, Babesia, Bartonella, additionally, Mycoplasma, Candida, certain parasitic infections, certain viral infections like Epstein-Barr, HHV6, cytomegalovirus, parvovirus, sometimes toxoplasmosis. This is what can be seen in once the lab results come back, right? Remember, we do urine, stool, with collaborating primary care doctors will run the blood work. So we get a lot of information on the child, and the protocol is completely customized for each child. So symptoms, as we know, differ from one child to another. There are certain similarities, of course, in overall PANDAS symptoms and symptoms of autism spectrum disorders, but the frequency, the extent, the intensity is quite individualized and is quite specific to each child on their own. So die-off, right? Die-off will occur, once again, to recap, within hours after either starting a new antimicrobial herb or increasing the dosage or the frequency of an antimicrobial herb. So that is what gives you the clue. Now, this die-off reaction, in my experience, can last anywhere from 2 hours to 2 days to 2 weeks. Is what I've seen, personal as well as clinical experience. So that is your typical die-off reaction. Now, what happens is there is a baseline shift at the end of the die-off. Now, all parents are instructed to handle a Herxheimer reaction. Right now, I'll be doing a separate video on how to handle a Herxheimer reaction, but there are some simple strategies that are inbuilt into the BioNexus protocol. So you have these on hand. Remember, the BioNexus protocol is a diligent, customized, step-by-step approach to treating each individual. And you have many supports already built in prior to being instructed to start the antimicrobial herbals. So the goal here, right from the beginning, is to make sure that the patient comfort level and the intensity of die-off reactions is minimized. So that, in essence, is your die-off reaction. When I say there is a baseline shift, meaning there is a baseline shift for the better. So meaning you will see at the end of the die-off reaction, you will see an improvement, however small it may be, but you will see a change for the better. So you know that the microbial load has been lightened and the patient starts to feel better, and hence you see some symptoms improving. So that is a true die-off reaction, right? Here's the mistake that I find many newly joined parents or patients will make. Newly joined, I mean, the ones who are new to the protocol. Okay, now seeing a flare-up can look very much like regression in your child, and that can be a frightening concept for most people, most parents. If we talk, let's take a moment and talk about children with autism spectrum disorder, right? Over 95% of children with autism spectrum disorder in my practice have PANDAS type issues, and also Lyme disease, a biotoxin illness. So these are various triggers for PANS and or biotoxin illness. So that's kind of important, to identify the triggers. And I'll get into this in a moment. But what I was saying was, watching your child in a flare-up is highly distressing, and many parents have reported depression, anger, interpersonal differences between mom and dad, between husband and wife as well. If it is an older patient who's going through these flare-ups. But actually, wait, let me just focus on autism spectrum disorders today. So if you see a flare-up, first thing is you have to distinguish whether this is a Herxheimer reaction or is this from another reason. Now, many people make the mistake of assuming it's a die-off reaction, because understanding what a die-off reaction is can sometimes be difficult. Sometimes, parents forget what exactly it is. All right, so as I explained a few minutes ago, a die-off reaction happens within hours, maximum 24 hours is what I've seen after starting a new antimicrobial or increasing the dosage. If this is not the case, if you've been on the protocol, if you've been doing these antimicrobials for a while, it cannot be a die-off reaction. I've had patients who've managed to cruise to full dose of the antimicrobials, and patients meaning patients with autism. So the parent has worked hard and little by little has built up the antimicrobial dosage and frequency to the prescribed doses, and has been on that for a few weeks, even with the child literally cruising through it, right? Because it was a slow build up. And in addition to that, there was a lot of foundational and support protocol supplements, herbals, which are done prior to starting the antimicrobials, right? So these parents will request an urgent meeting and say that, the child is going through a severe Herxheimer reaction. Oftentimes I find that is not so, because I ask them, is this a true Herxheimer? Let's try and dig deeper and try and differentiate. So if this is happening to you, if your child has been doing well on the antimicrobials, there's been no increase or change in the antimicrobials, and for a few weeks, even for a few days, if he's doing well, it is very important that you do not presume it is a Herxing reaction, right? Because if you presume it's Herxing, then that means you are not putting in due diligence and looking for the trigger. Okay, so flare-ups are usually re-exposures. Okay, if they are not Herxheimer reactions, then they are re-exposures. So don't make the mistake of not immediately looking for re-exposure. Now, what kind of re-exposures am I referring to? So the most common re-exposure would be re-exposure again to a moldy environment. It could be in school, could occur on the school bus. You have a child who's at school for a good 6 to 8 hours, right? Usually in children that are susceptible to biotoxin illness, within 90 minutes, the cytokine start rising and you can see flare-up symptoms. And by the time the child gets home, the flare-up may be in full swing, right? It is something to pay attention to, something to keep track of exactly when the flare-up is occurring. Was it right after the child got home from school? Did it happen in the school itself? Did you hear something from the teacher? Did something happen on the school bus? Was there a child in the class that is ill or came back early from illness? These are all various scenarios to consider. I'll give you some examples, right? Children with autism spectrum disorders are often in a special needs classroom. Special needs classroom have other children with special needs, and many of these children may be carriers of PANDAS triggers like strep and mycoplasma, correct? Many of them may also be bringing in jackets and clothes and backpacks, notebooks, etc., from houses that are water damaged and have mold spores on them. it is not something that is easy to distinguish or to avoid, is it? So, I mean, you can put your child in a bubble. Socialization is important. It's important that the child goes to school. And for the most part, you have a child that is on the BioNexus protocol. The flare-ups should not be, and sorry, let me backtrack. You have a child on the complete BioNexus protocol, including antimicrobials, then the flare-ups are not quite as bad, because if the child is exposed to a trigger, then in essence, that child is already being treated for the trigger. So when the child is on the full BioNexus protocol, including antimicrobials, it is rare for me to hear of flare-ups, unless there is a pretty well-established mold exposure. It can happen, sometimes children go to friends or relatives' houses that are water damaged, or there is a playroom in the basement which has had flooding, and then they spend a few hours there. Sometimes grandma's house, and they spend a couple days there, and they come up with a full flare-up. Sometimes they go on vacation. The hotel can be moldy. They go on vacation to vacation rental homes. Those could be moldy, right? So you have to be sort of like a detective to find out exactly where the re-exposure is, or what the re-exposure was, instead of sitting back and erroneously waiting for an urgent appointment, thinking that this is a Herxheimer reaction. Okay, so look for exposure. Any other examples I can think of? Let me see. So we are looking for exposure to mold, any other environmental toxins, to strep, staph, marcons, mycoplasma. So, another child with sore throat, with a fever. Nowadays, actually, of course, COVID exposure, if another child has had COVID. And, one patient I had went to school, was doing phenomenally well, right? So after a whole year of missing school, finally felt better. The house was remediated. Mom put in enormous effort to make sure that everything is in place. And this poor kid goes to school. And within about a few weeks, is back in bed, non-functional, barely functional. So long story short, I say that a lot, right? Because, I have such complicated patients with complicated stories. I would keep you here for a couple hours if I were to go into all the details. But here, what happened was, the child sitting next to my patient, even with the mask on and what have you, I mean, at that age, the mask falls off, and many a times the teacher doesn't know this. So was diagnosed with COVID, had been coughing, sneezing. Now, when my patient was tested for COVID, the test came back negative. Okay. Now, the test came back negative, but the patient had many, many symptoms of the Delta variant, right? Severe headache, severe gut pain, and fatigue. Those were the only three, not many. Those were the only three symptoms, actually, and unrelenting three symptoms. No matter what the mom tried, we had the neurologist on board, we had the family care practitioner on board, until finally it was revealed that that lot of COVID testing was faulty. And CDC had issued a recall on that batch of testing because it was coming up as false negative. So that's like, that's obviously an unusual freak event that happened. But bottom line was, we were investigating every possible avenue, And this is what comes up when you dig deep, exercise due diligence, and find out. Anyways, he's doing much better now. He was treated accordingly, and he's doing much better now. Then there was another patient who went into a severe flare-up. Okay, nothing seemed obviously wrong with the child, as in an infection. There was no fever, there was no obvious sore throat. And what we found out eventually was that the child, in the middle of the night, as many of our little ones do, right? Middle of the night when they wake up, they come into bed with us. And the mother had been recently recovered from strep, or not even fully recovered, was trying to avoid antibiotics and just trying to get better naturally. So the child developed a flare-up because of that. Sleeping near mom, probably acquired what mom had. And as we know, strep, staph, mycoplasma, and mold, of course, are very strong triggers for PANDAS type reactions. Okay, so please investigate thoroughly. Now, in many houses that have been cleared of mold, there can be microorganisms that have already grown when the house was moldy or a water damaged structure prior to cleanup and remediation. Now, these microorganisms, many of them will die off once the remediation has been done correctly, and many don't, depending on where they are. So they're called as actinomycetes. Now, actinos can also cause flare-up symptoms. Okay, and so this is one other aspect to investigate. Now, another thing that comes to mind is volatile organic compounds. Patient moved into a brand new house. If I recall correctly, it was Florida. So family moved from Maine to Florida for the warm weather, and I think they were closer to support family as well. I can't recall the whole incident, but yes, but I do remember pretty clearly what had happened with this child. Was on the spectrum, of course, but doing excellent while they were in Maine in a house that had been remediated. And the child had, language, communication, socialization, anxiety was down, sleep was better, gut was better, bowel movements were regular. Now, after all this improvement, this child behaved phenomenally all the way down during the drive. They actually drove down all the way from Maine to Florida. They said, we'll just do the move in one fell swoop. So along with the moving truck, they just got in their minivan, and they just followed the moving truck just to make sure that everything flowed along smoothly. Because those of you who are here in the US know that sometimes the moving trucks can take their own good time to get to the destination. Like we are there, and where are the movers? Who knows? So, with all kinds of lame excuses. So I think this was a good idea, but, and they thought they were moving into brand new construction, which had been wiped down, cleaned up, and what have you. So they moved in, and within 2 to 3 weeks, the child was almost fully regressed. What happened? Once again, I discussed with mom. Mom was beside herself. Obviously, it was so difficult just having moved to a new place, trying to adjust herself, and having to see this is what's happening with her child. What had happened was it was brand new construction, but it wasn't built green. It was standard contractor grade new construction. So the kitchen cabinets, the paint on the walls, the insulation was foam insulation. So these are all, oh, you know what? And the family bought all new furniture, including including a new car as well. So there was a lot of outgassing from all of this new stuff all around the child. Additionally, you know, the child started a new school, and later we found out that it was one of the buildings that had old hurricane damage, which had occurred in the building as well. So long story short, again, is this is what had happened with the child, is volatile organic compounds, VOCs. And those have to be kept in consideration as well. You know, we'll have to do, this is again becoming a long video, isn't it? So we'll have to do another video with respect to, you know, send me questions, because I've done lectures, you know, physician training conferences that have lasted like a few days at a time. So, and my experience has been over the years, right? Personal as well as professional. And there's been like thousands of patients from like over 70 countries. So I have so many different little case studies and anecdotal evidence that I can share with you. And I try to select a couple cases in case that resonates with one of you watching. You know, before I go, one last incident that I'd like to share about flare-ups is one child, again, doing really, really well, very similar to this child who moved from Maine to Florida, but, you know, this child was in Pennsylvania and doing really well. Very, very sensitive child, very high mast cell activity on the spectrum, yes, but beginning to speak in phrases, small phrases, and beginning to eat and grow. Appetite was much better. Gut was much better. So mom and dad, oh my gosh, they worked so hard to do everything they could, you know, for this little tyke. And 4 years old. What happened was the car, I think dad's car was found to be borderline water damaged, or like, you know, they were not sure, but there was a little bit of a musty smell. So they decided to trade it in and buy a new car. And dad bought a brand new car, one of those electronic cars. I don't want to, you know, take any names, but, you know, it's one of those very modern car that's all electric, that runs on fully on a battery, not on gasoline. And this child loved car rides that would calm him down. He would go to sleep, and then, you know, they would bring him in from the car seat. He would stay asleep. So that was something, an activity which wasn't so unusual. So a lot of information is you know, shared during Zoom appointments. And this had been shared with the family, that to avoid any new car smells, any VOCs, any EMFs, but in the excitement of a new car, that was forgotten. And this poor kid, after only 2 hours in the brand new car, inhaled the new car smell. There were obviously very, very high EMFs from the completely electric car. And poor kid, I mean, poor mom and dad, it took this child nearly 3 months to calm down. Extreme hyperactivity, almost back to square one as far as symptoms and regression goes. Not sleeping, aggressive, hitting mom, pulling out mom's hair. You know, this went on to the point where mom literally had to shave her head off. shave her head so he wouldn't have, bushels of hair to yank out. And we did everything we could to keep him calm and happy. And, of course, we changed the supplements accordingly. We scaled back to a completely calming and supporting protocol, just mild detoxifying. And what was needed once it was identified, right? If it was a new car, because I remember the first appointment, we had the 15-minute urgent appointment because he was so sensitive. Mom thought again, like most parents think, that it's a Herxheimer, it's a die-off reaction. But it wasn't. I mean, this kid had been on his herbal protocol for a while. I think it was easily 4 to 5 weeks, and he had been cruising along, doing well. And then this happened. And I always ask, did you get any new furniture? Because new furniture, I did another podcast based on Q&A again, right? The new furniture can sometimes have warehouse mold in it if it's not properly cleaned before you bring it in the house. So they did not buy a new furniture. And then we actually, put him on, we actually put this child on a Herxheimer protocol, and we hung up the meeting. Then immediately, 2 hours later, mom just messaged through the online messaging portal that, hey, please tell Dr. Dashore that I completely forgot to tell her that we do have something new, and it's a new car. And my son was exposed to that. So then I actually stayed back after hours, spoke with her again, and we came up with a EMF as well as VOC detox protocol. So it's very important to identify triggers. It's a very happy ending, right? This was like about 5 months ago. I've had another follow-up with this family since then, and this child is back on track. He's recovered. He's started. He's reading. He's writing. He's doing a little bit of addition and multiplication. Hasn't quite grasped subtraction yet, but he's doing he's doing really well in math. Fairly okay in language. So he kind of caught up. Once we were able to detox his, once we were able to identify exactly what's going on with him, we were able to come up with a customized, individualized protocol for him. Now, you have to customize. You can't just go with all right, generic detox, let's do this. This child had a CBS 699 mutation, so sulfur sensitive, also had MTHFR. Actually, the CBS 699 was homozygous, and MTHFR 1298 was also homozygous, and C677 was heterozygous. So a complicated methylation panel as well as a genetic HLA-DR susceptibility for mycotoxins and mold. So we customized his exposure, the new exposure detoxification protocol according to his genetic profile, and he's doing really, really well. So it was important to let you know that, right? Now, I'm not, there are many medical treatments that are done as in pharmaceuticals that are given by PANDAS specialists, MDs, DOs in the United States and elsewhere in the world as well. And that is completely compatible with the BioNexus protocol, because often, short-term antibiotics, well, I don't want to get into that because that's not really my field of expertise. But I do have experience, obviously, with my son as well as patients. So yes, antibiotics and ibuprofen, if used correctly, can be quite beneficial. Lengthy use is not required. High doses are not required, especially if you have already built up to the full dose of the BioNexus protocol, especially if you're doing antimicrobials. Just schedule a brief meeting and we will customize it for your child, exactly what your child needs based on what symptoms are flaring up. And it seems to work out pretty well. So, all right, so that brings us to the end of this Q&A session. I wish I could share a whole lot more. Hey, wait, actually, before I go, one important reason for flare-up, right? Actually, two important reasons, and they are both to do with diet. One is any kind of variation in diet, right? Because, sometimes kids will go to a birthday party and either knowingly or unknowingly, they'll sneak something in that they're not supposed to eat. Now, depending on their level of sensitivity, their mast cell activation or multiple chemical sensitivities, because many food items have artificial colors and flavors, and many processed foods as well, right? So many processed foods can also be contaminated with MSG. Other glutamate type reactions can happen as well. So that could be a reason for the flare-up, right? If there was, again, any kind of dietary infraction that happened. Last but not the least, that I can think of today for this video is camel milk. Many parents in many parts of the world, of course, camel milk is a superfood. Okay, it has antibodies, it has nanobodies. Nanobodies are 10 times smaller than human antibodies. And often consuming raw camel milk, based on online advice that many parents seem to obtain based on the experience of, based on positive experiences reported by other parents without adequate detail. Obviously, every child is different. So anyways, I know that all parents in sharing their experiences are well-meaning, right? Everyone wants to see a child on the spectrum or any child suffering do well, of course. So the mistake happens here is adding in raw camel milk at the wrong time. So PANDAS is an autoimmune condition. When you add in antibodies, nanobodies, antibodies, at the wrong time in a child, that can exacerbate the autoimmunity. We don't need immune boosting at the wrong time. In fact, in most of my patient population, immune boosting may not even be required, or may not be indicated at any time. Immune modulation, it's what's required. Now, for immune modulation, camel milk needs to be monitored. It needs to be used as medicine. Let food be thy medicine. And camel milk is one such amazing product that needs to be used under supervision until the child is stable enough to be able to handle the nanobodies. So anyways, once again, we will speak about camel milk. You have any questions, please send them. But we will speak about camel milk in a separate podcast. Actually, I'd like to talk about MARCONs as well, right? I discussed exposure to mold again. Now, say, for example, the re-exposure rather, happened at school, right? Many children after the pandemic and having online instruction, many have started to go back to school. And remember, these schools have been shut down for a long time. and reopened, and not all the schools. I've heard, at least in the United States, that many schools have upgraded their HVAC system, their HVAC and ventilation systems. But that may or may not be the case elsewhere in the world. So one has to keep that in mind. So when there is a water damaged building, there's always the chance of being reinfected with MARCoNS. On my travels to different countries around the world, to different states in the US as well, staying at different hotels, sometimes when I am re-exposed to mold, I always carry a little air purifier with me. Yeah, even when I travel internationally. But sometimes, you can't drag the air purifier to every place, right? So if my room is being cleaned out by the air purifier, then I might get re-exposed in the conference room. And that's happened to me several times. I come back home, I retest myself with the nasal swab, and it shows up, positive for MARCoNS again. So that is something that can happen. And MARCoNS, as you know, release toxins. I talk about MARCoNS in many of my lectures. There are many lectures from different conferences that I've spoken at, and you can certainly look it up on YouTube, that MARCoNS will secrete exotoxins A and B, which cross the blood-brain barrier and increase inflammation, different structures in the brain. In fact, I have a completely separate book in the works, simply because MARCoNS are so critical when it comes to treatment of autism spectrum disorders. So you will find a lot of details in the book. But for the purpose of this video, it's important to understand that any re-exposure to a water damaged building can also mean a re-exposure to MARCoNS. Additionally, reservoirs of MARCoNS re-exposure can be you as parents. And dogs have been established as reservoirs as well. I know that canines have been established as reservoirs, but felines or cats are being looked at, to the best of my knowledge. They may carry MARCoNS, but it's not easily transmitted to humans. But canines, it is easily transmitted to humans. Canines do have reservoir of MARCoNS. Doesn't affect them, but once transferred to the human, it acts like MARCoNS in the human. MARCoNS, as I've explained to you before, is multiple antibiotic resistant coagulase negative staph that comes with biofilm, immune dysfunction, as well as colonization of the sinuses, and causes increase in inflammation, increase in cytokines, because the toxins can cross the blood-brain barrier, especially in a child on the spectrum. So that's another aspect that needs to be revisited and investigated if your child is going through a full-fledged flare-up. Again, small flare-up, large flare-up, doesn't matter. All causes have to be investigated, right? So I thank you very much for joining me today, for listening in. And I look forward to bringing a lot more podcasts to you on topics that you find are important, as well as I shall continue to answer. I still have quite a few questions that I have to get to, so please keep sending those questions. I look forward to reading them, and I look forward to seeing you at the next podcast. Bye for now. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.